Hi, I'm Dave Fornell, editor of Diagnostic and Interventional Cardiology and associate editor of Imaging Technology News. I'm here at the 2011 Radiological Society of North America Conference in Chicago, and I'm here to show you some of the latest technologies that are being offered in imaging by vendors here on the floor. We're here in the Siemens booth at RSNA 2011, and I wanted to show you the Somaton Definition Edge. This will be the next generation single source CT scanner that's being introduced by Siemens Healthcare. The system uses a new type of detector technology which helps reduce noise by a new set of microelectronics in each one of the detectors. This detector will come in between 128 and 256 slices, and it's pending both CE mark and FDA. Let's take a look at the technology. Siemens standard detector technology is on the left, which has quite a bit of microelectronics in it, and the new detector technology for the stellar detector is on the right, which uses a nano microelectronic technology to eliminate noise by reducing the amount of heavy electronics. We're in the Toshiba booth at RSNA 2011, and they have an introduction for the Apleo 500. This is their newest ultrasound system that they're introducing here at RSNA, and it has a couple interesting features that are new to ultrasound. They have a fly-through feature where they could actually take any fluid-filled space, such as a blood vessel or a uterus, bile ducts, hepatic vein, as is seen here. And they could actually do a fly-through and be able to visualize the structure from inside instead of outside as you usually see it from ultrasound. What's interesting about this technology is it actually offers almost a CT-like view, similar to what you would see it with colonoscopy or a virtual colonoscopy. The Apleo 500 also offers a feature called Smart Fusion technology, where they could take a CT data set and they could align it to the transducer. So whatever you're imaging with the ultrasound transducer, and as you rotate around the patient and manipulate the transducer, will also respond directly with the CT data set on the left side of the screen. This image actually shows a biopsy needle going in, and as the needle reacts with the tissue, you can see the CT data set on the other side, on the left side, actually reacting just as the ultrasound is. We're in the Fuji booth at RSNA 2011, where Fuji is showing the MammoAscent 3D mammography system. You have to wear glasses in order to see the images, which are two images that are shot a couple degrees off from each other. But with the glasses, it allows radiologists to take a look and dismiss overlapping tissue. If you have several calcifications that are close together, you can actually differentiate the spatial differences between them to show that they're not in one concise area. The system has CE mark and has an install site currently in Germany. One of the studies that was conducted overseas, they found a 46% reduction in false positives and a 23% increase in sensitivity. And the radiologists using it felt that they were able to read the mammograms a little bit faster than with traditional 2D mammography. We're at the TeraRecon booth at RSNA 2011, where they have two interesting pieces of advanced visualization software for cardiac analysis. One of them we'll take a look at strain motion within the myocardium, very similar to what you would see on an echo wall motion. The second piece of software TeraRecon is showing is not FDA cleared yet, but it is kind of exciting because it is CT myocardial perfusion imaging, where they could take a CT data set and they could actually color code it very similar to a PET or a SPECT image to actually show ischemia on the myocardium on the beating heart of a CT cardiac cycle. We're at the Vital Images booth at RSNA 2011, where the company just had FDA approval last week for a new software package called CT Myocardial Analysis. And this software takes a look at the contrast wash within the myocardium and could be presented both on a bullseye and also a wrap on the left ventricle itself. We're at the Vitsua booth at RSNA 2011, and this is a brand new advanced visualization company that started business about 10 months ago. It offers a lot of the same features that you'd find with other advanced visualization companies, but it offers an interesting new business model. It offers a simple tool set and a very easy to use sharing program to where images from hospitals or imaging centers can be easily shared with referring physicians and also with patients. And the company is betting that its ability to share images with patients especially and allowing them to actually manipulate their own image data sets will be a big return on investment in the future.